Today is a full and incredibly meaningful session, and so I'm excited to get started with you and to welcome you officially to the COVID Advocacy Exchange. I am Dave Fuhrer, the CEO of Grit Health. I'm a cancer survivor and a cancer caregiver, and it is impossible for me to believe that this today is our 1-year anniversary of the COVID Advocacy Exchange. We started this session a year ago in May, and so this officially marks the 1-year anniversary of the exchange, which is impossible to believe. As we move into our 2nd year now of this initiative, Bristol Myers Squibb and Grit Health and Evoke Kind have very exciting news that we'll be sharing with you next month in June. So stay tuned for that. It will be information about the evolution of the COVID Advocacy Exchange to expand and enhance the exchange to best serve the global advocacy and patient communities. So we're incredibly excited about that. Today, this session is our 21st live interactive session in the exchange. And these have been incredibly courageous and critical conversations that have all been co-created with the global advocacy community. And so 600 advocacy professionals from more than 300 different advocacy organizations around the globe are members of this platform. And together, we have now welcomed 31,000 people from 140 countries around the world. It's just mind-blowing to try to comprehend that. Today's session is particularly important now as we're more than a year into the global pandemic. And so in recognition of Mental Health Awareness Month in the United States, we're going to hear from Teri Brister, who I respect tremendously. She is the National Director, Research and Quality Assurance at the National Association on Mental Health. And Teri will discuss how to navigate the U.S. healthcare system to receive mental health support. We will then hear from Dr. Cindi Slater, and Cindi is the Senior Vice President, Medical Affairs at ConsumerMedical, and her work and her passion in life is about the value of creating innovative approaches that lead to more patient-centric care by putting patients right at the center of everything we do. And so honored for you to interact with Cindi. And then we will, for the last hour from 12:30 to 1:30 Eastern, break into our 4 working groups, and each of our 4 leaders will share with you an arc of advocacy, which is now one of the first outcomes from the exchange and something we've created together. And so really excited to share that with you and get your input in those conversations. If you can sense emotion in my voice, you're probably spot on. The last thing that I want to share before we welcome Teri for the opening keynote is to acknowledge why mental health awareness is so important for me personally. And so many of you, if you know me, know that I'm sort of an eternal optimist and always excited and ready to create good change. What many of you may not know is that at 31 years old, after my 2nd cancer diagnosis, I sat at the kitchen table with my mom and my dad, and I told them I didn't know how much longer I wanted to be alive. And the reason I told my parents that was because not only did I not know how to cope with the anxiety and the depression from everything I was going through, I was too full of shame to even know how to ask for help or think it was possible. And so knowing where I was in that dark place to be a part of this with you, creating change and having open conversations is a place 10 years ago I never thought I would ever get to. And so it is because of my journey through mental health that I am deeply, deeply honored and grateful to welcome you, Teri, to the conversation. Please, everyone, welcome Teri Brister.
Dave, thank you so much. And just I should learn. This is my 2nd rodeo with Grit, and I should know never to think I'm prepared, because you're never truly prepared. And this is what happens in the NAMI world. Everybody has a story, and you never know what's in the room. And I know you guys all experience that in the work that you do. So Dave, I want to begin by thanking you for sharing that. And I wish I had two things before I start my slide deck. One is I wish I could tell you that the world is so much different now than it was 10 years ago, and it was so much easier to talk about it. It's a teeny tiny bit different, but we've still got a long way to go. And conversations like this one are really where it happens. The other disclaimer I want to make, I don't have a disclaimer side, but I'm going to add one here, is that I wish I could also tell people how to navigate the mental health system in the United States. But that's, if I figure that out, you guys will be the first ones to know. What I do want to share with you is what NAMI does to try to support people figuring that out. The President's New Freedom Commission, George Bush, when he was president eons ago, maybe before some of you on the phone were born, he commissioned a group called the New Freedom Commission to look at the state of mental health services in the United States. This was in 2003. And one of the major findings was the most indicative thing of what your mental health system looked like was your zip code. It's where you live. It varies from one community to the next. So again, what I want to share are some resources, and more than anything else, to send the message that you're not alone as you try to figure this out to help the people you're serving, and that you can let them know they're not alone when they feel confused and overwhelmed. So now let me go back to the original plan, which was to share my screen. And I'm not going to read slides to you, and these slides will be made available for you, but did want you to have something to refer to after the presentation. And as I mentioned, this is the second time I've been invited, and I consider that a great honor because I'm so moved by the work that all of you do, and everybody who I've met that's part of GRIT and the people that they reach out to, we're all trying to do the same thing. Helping people live their best life in spite of incredible challenges, which, as we all know, come in a variety of ways. And what we've seen with COVID-19 is it has put the spotlight on every strength and every weakness that we all have. It's really brought so many things to light. Let me talk to you briefly about who NAMI is, the National Alliance on Mental Illness, and some of you may be familiar with this already. But we are the largest grassroots mental health organization in the U.S. We do have some of our programs available in Italy, Mexico, and Canada as well. But we started around a kitchen table. It was moms and dads 40 years ago who couldn't get what they needed for their adults, children who were living with schizophrenia, institutionalized. And they thought the world has got to be a little better than this. So we started out by people supporting each other. It grew into an advocacy organization. What do we do? Everything NAMI does at its core is really boils down to these four buckets. We provide information and education about mental health conditions, what it's like to live with them, what it's like to have, what those experiences are like. How do you find treatment? How do you find support? Why do you need it? And also that this isn't your fault. We spend a lot of time helping people unlearn things that society has told them. We provide support, we provide advocacy, not just at the federal level on Capitol Hill, but also we help people learn how to advocate for themselves with their caregivers, with their treatment systems, with their insurance companies, with their employers, with their colleges, if they're trying to go back to school and running into discrimination and barriers. And one of the things that's popped up during COVID is our being asked to assist healthcare professionals who have faced challenges by their licensure boards when they've tried to seek mental health services. And if that's not discrimination, I don't know what is. So again, a whole plethora of things that have opened up during this pandemic. And then last but not least, we raise awareness, hopefully trying to chink away at the barrier that keeps us from being comfortable, talking about what's going on with us and asking for help. What makes NAMI different than other organizations? We really are all about the peer experience, and I know you guys get that because I suspect everybody on this call is living with some type of physical or emotional challenge, and that's what makes NAMI different. You know, there's the saying in the peer support specialist movement, nothing about us without us. All of our programs are taught by people with lived experience. If it's a family program, it's taught by families. If it's for someone with mental illness, it's taught by someone who's in recovery. And there's nobody who can better help you navigate the journey toward recovery or the journey to finding the ways to deal with the system and find services than if people who have been there before. One of the things we hear frequently from, probably the thing we hear most frequently from people who come to our classes or who want to learn to lead our programs is, if I can save one person some of the steps and the barriers and the hurdles that I had to go through to get where I am. And that's really what navigation is all about. Why it's important, I'm preaching to the choir, not going to read the stats to you because you can read them for yourself. But what I want to spotlight is what we've seen at NAMI. And we have and I should have said this in my original Who is NAMI? We have a NAMI national organization that's about 100 staff. It's based in Arlington, Virginia. I work remotely from my home in Mississippi because much of what I do in a non-pandemic year is traveling around to work with the 48 state NAMI organizations and the more than 600 NAMI affiliate organizations, helping them figure out how to reach people who need them in their communities and providing the advocacy support and educational programs. But one of the things that we've learned at the national level during the pandemic through our NAMI Helpline is what people have been concerned about this past year. We've had the helpline in place 30 years or more, and historically the questions skew. The top questions are around psychosis, psychotic disorders, schizophrenia, second by mood disorders. Throughout the last 13 months, the primary point of concern has been anxiety. Other things going on, but the primary point of concern has been anxiety, and that's held for 13 months. The level of severity of crisis situations, acuity that people are calling with has increased like 500%. When you look at the number of high acuity level calls that we got 6 months ago to the ones that we received in April. So again, indicative of what's going on in our world. And again, there were challenges to finding services and challenges for people with mental health conditions and other physical conditions pre-pandemic, but this is just kind of, again, put a spotlight on everything. Another statistics that surprises some people, probably not anybody on this call, but the small percentage of people who actually get services or stay engaged in services. And I know engagement is one of the things that y'all are going to talk about today. I want you to look for just a minute and stop and think for a minute about how the onset of mental health symptoms can affect the person and their family. They change the way we interact. They change the way we feel about ourselves. So they change the way we present ourselves to others, which again makes us more stressful, makes us tend to self-isolate, as Dave was talking about. You know, I don't want to be with other people, but I really don't want to be alone either. You know, and it happens. This becomes a feedback loop. The fear and the anxiety make the symptoms worse. And at some point in time, there has to be an intervention. If you don't do something to make a difference, the circle continues. What we've seen during COVID, this is, again, traditional times, but when you layer the template of the COVID pandemic on top of this, you had a year of closures. You know, person-to-person, face-to-face contacts weren't happening. So you have a mental health system that didn't have enough treatment providers already. There's a shortage of mental health providers, not just psychiatrists, but social workers and therapists. There's a shortage. There's stigma about coming into the profession of behavioral health services, just like there's a stigma about having a behavioral health condition. My husband's a psychiatrist, and literally, I can't tell you how many times I've heard people ask him why he didn't want to be a real doctor. There's that stigma there, again, even in the healthcare profession. So again, not enough providers, not enough clinicians, not enough services, the typical access challenges that we have. But then you layer the look at it through the lens of COVID. Telehealth became a thing. It was a thing before, but it really became a thing this past year. But if you're a little suspicious or anxious about using your smartphone anyway, talking to someone like this via Zoom or on FaceTime or however you happen to be able to connect with your medical provider or your behavioral health care provider is anxiety provoking. My father doesn't have a smartphone. He had to meet with his doctor, his provider, to keep his insulin going through telehealth. He didn't want to bother my brother and I, so we didn't know he was missing his appointments. He doesn't have a computer. Again, there's an assumption that everybody has access to all of this stuff, but even if they have smartphones, they may have limited numbers of minutes. So again, the things that we just don't think about in terms of additional barriers that came into an already burdensome system. And one of the things we've heard consistently in the mental health space is the inability of those wraparound services that people with serious mental illnesses need to be able to stay in their own home, in their own community. It's more than just medication. It's more than just seeing a therapist, but it's the peer support specialist. It's home visits. It's drop-in centers, day treatment programs. Those things stopped. So we heard from so many people that their symptoms returned, that they had to go back in the hospital because those day-to-day services weren't there anymore. And I would suspect there are similar concerns in other conditions as well, where home health services may have had to stop or to change. But again, the point is, this isn't helping you navigate it, but it's painting a picture of something that was already complicated and complex, got more complicated. Common things that people can experience when they're trying to make the decision to seek treatment, because that really is the first hurdle to cross, is making the decision to ask for help. This is before you figure out that the system is tough to navigate, but you can feel like there's something wrong with you. You know, it's a character flaw, it's a weakness. I must be the only one that feels this way. And thoughts of not necessarily, maybe it's not to the point of I want to end my life, but thoughts as Dave was sharing, I don't really want to be here anymore. Don't really want to be gone, but I really don't want to be here anymore. We hear that so routinely. And so frequently this past year during COVID, people have been having those experiences and being more isolated while they were having them. So some tips for engaging people when they're, and I had come at this more from an engaging than a navigation, and these are preaching to the choir for you guys, so I'm not going to spend any time on these because I'm mindful of the time. But it really, if you saw in one of the first slides, where roughly a third of the people who with serious mental illness who seek treatment and get enrolled in treatment stay engaged. People have to feel like they're benefiting. They have to feel valued. They have to feel like their treatment provider, that the health system, the behavioral health system is giving them something that's meaningful and that's worthwhile. Because it's hard, for all the reasons I've mentioned in the previous few minutes. It's hard to have mental health symptoms. It's hard to ask for help. It's demoralizing. It's just demoralizing. And you get your courage up to go and ask for help. And then you make a call and you get a recording and you finally do get a person and you find out your insurance doesn't cover the services they provide, or they have a 6-month waiting list, or we don't see people with your type of condition. That happens frequently in the mental health space. I have a very good friend who's a psychologist, but she doesn't treat people with depression, which covers a lot of territory. but because of her family experience, it's too hard for her personally. But again, that's another challenge. You break your leg, you call an orthopedic surgeon, and they pretty much see you when they can fit you in. And that's not the case with mental health conditions, and that's a surprise. So you work your courage up to seek services, you finally make the calls, and then you run into these barriers. But you get past those barriers and you meet with the therapist. And if you don't engage, if you don't feel like they're engaging with you, whether it's the clinician, whether it's the psychiatrist, it can be the person at the front desk. Those are some of the primary reasons people drop out of treatment. They have one bad experience and they don't go back. NAMI developed an engagement report a couple of years ago, and there's a link to it here. I've also shared it with the GRIT team, so they'll have it available for you to download. I'm not going to read through these, but we pulled together a group of healthcare providers and individuals who had experience with mental illness and their families, and defined what are the 12 big things. What are the 12 big things that providers need to know when they're working with people with mental illness and their families? And they're things that are going to be, again, these are no-brainers to you guys. Talk to us like we're people. Include us in the treatment planning process. Let us know what's available and what our options are. Help us understand how to navigate your system. Don't assume we know what following up with such and such specialist means. Walk us through it. Talk us through it. So again, not going to read those to you, but I would encourage you to give that document a look because it's really, really pretty powerful. The final one, which I think should have been the first one, but I wasn't involved in the work group that put it together, is peer support services. I can't, not you, I'm going to use an I statement. I can't emphasize enough the importance and the value of peer support with mental health condition, with all conditions, in my opinion, but mental health conditions specifically. And there's nowhere that peer support is more helpful than in learning to navigate the system. Because the mental health, we don't have a true healthcare system in the country, but we have even less of a mental health system, and it looks different in every community. Every community. Medicaid is different from state to state. And within states it's different. So again, can't emphasize that enough. I want to leave you with knowing where you can go to. NAMI's programs are all free. This is not a NAMI infomercial, but again, we are one source of support. And I look at NAMI as and I'm in Mississippi, I try to be visual and be real simple with how I talk. I see NAMI as kind of this spider web across the country. We don't pretend to have all the answers or to know everything, but we know somebody somewhere that can help get you one step closer to the answer. You are the people you're working with. So I wanted you to see that on our website, you can actually find the NAMI nearest you. I mentioned that we have 600 affiliates and 48 state organizations. We do have support and education is where you can go to find information about the support groups and the education programs. And then our NAMI Helpline. We have a connection with the crisis text line. But we also just recently launched the chat feature. We launched that in January, and we're going to be launching a text feature later on this year. One of the gifts that the pandemic has given us is forcing us to become more virtual. And where we limited ourselves to volunteers for the helpline in the Arlington, DC Beltway area, we now have volunteers across the country. And we're able to engage people who've wanted to reach out and help people, but haven't been able to in the past. And a couple of other resources I wanted to make you aware of. One, and again, all of these are available at NAMI.org. And I've also given the PDFs to Eileen to share later. But Navigating a Mental Health Crisis Guide. This is it's 33 pages, which is super, super long, but it's the document I wanted when I worked at mental health centers and that I wished every chancery clerk in our state had in Mississippi. So when a family came in crisis and said, I don't know what to do, can I send them to the state hospital? They could say, here are other options. If you're seeing X, then do Y. So there are some helpful things in here, and including what people can expect. What are the barriers people can expect in the system, and how do you try to work around those? How do you be prepared for those? That's what the engagement report looks like. And last but not least, we co-developed this Circle of Care guidebook for mental health caregivers several years ago with the National Alliance on Caregiving. And then NAMI.org/COVID-19, our helpline team actually developed a COVID information and resource guide that's even got tips about telehealth. What do you need to know about telehealth and telepsychiatry? So again, that concludes my slides. Dave, I quit looking at my clock. Hopefully I didn't go way too long, but a pleasure to be here. And I want to hand it off to Cindi now, so she can share her information with you. Thank you.
Okay, terrific. Well, thank you, Teri. What a privilege to be alongside you today. And I have to say, I'm going to be talking about something that's a little different than what you addressed. But Dave, with your opening, I have to say that since COVID, over the past year, I have said so many times to webinars, to groups at work, exactly what Teri said. You never know what's in the room. Everyone has a story. So be gentle with your words and really listen to the people that are speaking to you. It's an incredible thing that, Teri, you mentioned some gifts that COVID gave. I think really being in the moment and being more compassionate is really something that is a positive spin that COVID can really be credited for, at least in the past year. So thank you all very much. Really just a privilege to be here. And I just need to see, oh, there we go. Okay, good. So I'm here to tell you a little bit about ConsumerMedical, who we are and what we do, and how we strive to make an impact in healthcare navigation. So we are a group of healthcare allies, and our mission is to engage, educate, and empower consumers by supporting optimal healthcare decisions with compassion and excellence. So we're positioned as a human resource benefit. So employers come to us to help their employees navigate the healthcare system so that the employees working with their own healthcare providers can make the best decisions possible for them at any point along the healthcare continuum. So I wonder if I can, so I'm going to give you a little overview of how we set up to accomplish that very tall order. So at ConsumerMedical, we believe that everyone deserves the very best that healthcare has to offer. And the way that we approach this is we put the patient right there in the center of the process. And I'll use patient and participant interchangeably with throughout our time together today. And that's because everyone's a patient, right? At some point, everybody is a patient. But ConsumerMedical doesn't establish a patient-doctor relationship, so we call the people that engage in our services participants, just to make that distinction. But to me, everyone's a patient. So we start by putting the patient at the center of the process. And the reason that we do that, because in order to get patients to a place where they can make the best decisions possible, you really need a deep understanding, not just of the diagnosis and the treatment options that they're considering, but really who they are, and what the best outcome looks like for them. And even with the same diagnosis, the best outcome might not be the same for two people. So what I mean by that is, just consider if I had osteoarthritis and was thinking about needing a total knee replacement. Success for me might be being able to get on the floor and play with my puppy. But for someone else, it might mean being able to play tennis or running a marathon. So you really have to layer in the participant, where they are and what their needs are and their expectations are to get to the place where you can have the most impactful decision making. So the way that we do this is, at the center of our core services is the patient, and then we apply what we call the 5 drivers of quality care. I don't want you to be overwhelmed. Yes, there are 5, but you don't necessarily need to address all 5 in any particular order. It's really about where you are, where the patient is in their journey, and which driver speaks the loudest when they engage with us. So I'm going to just review with you what these 5 drivers are. So the first, the diagnosis. So what diagnosis is the participant facing? What might that mean for them today? And then what might that diagnosis mean for them in the future? And then also importantly is that diagnosis accurate? So do you need to see a specialist? Do you need a second opinion? So all of those factors contribute to that diagnosis driver. Next, we have the doctor or the provider. So we use a data-driven approach to find the best practitioners that are appropriate, not just for the diagnosis, but appropriate for the particular patient at hand. So are there geographic limitations? Is somebody willing to travel? Do they need to travel? Are there language preferences or barriers in place? Are there preferences in terms of the gender of the physician? So all of these things come into play when you're thinking about the appropriate set of providers for your particular situation. The next really big driver is treatment, and we spend a lot of time educating and empowering participants learning about their treatment options. So we curate evidence-based, unbiased, up-to-date information to help patients make their best decisions possible by understanding the risks and benefits of a treatment option. We do that through a multimedia approach. So we connect with the patient and discover, do they learn best with audio? So do they need podcasts? Do they need videos? Do they prefer written words, electronic content? So we really tailor how we share information to the patient's particular learning styles. And then we put it in digestible bites, if you will, so that we're not overwhelming people with too much, so that they can really assess and reassess. Next, hospital is very similar to the approach we take with finding providers. We do the best we can with a data-driven approach to identify centers of excellence, if that's appropriate, or local facilities that really offer the best care for the situation at hand. And then last but absolutely not least is our coping driver. And this includes a lot of what Teri was talking about. So we absolutely address issues with the particular patient and the stressors and the anxiety they have related to any diagnosis. But it's also about equipping patients with ways to talk to their friends and family. How do you set expectations with the caregivers around them? How do we try to help connect participants to their peer groups, to online health communities, to foundations, to groups like this, to really speak to all of those things that go into the large bucket of coping. And again, I just want to reiterate that these 5 drivers are not to be considered all at once necessarily, or even all of them at any one time, but really just a guideline to touch upon to really help get a patient in a position to make the best decisions possible and an informed decision. So one of the themes today that you all are aware of is that the health system is incredibly complex. And so when we were building our models, we really learned early on that finding trusted information and support is key to navigating the healthcare system. And so we recognized that for our services to be most successful, we really needed to develop a high-touch approach that was tech-enabled, but really lean on a high-touch, trusted relationship development. So we built our team with a physician-led model that really places a nurse ally right at the center of that circle on my prior slide with the patient. And what that means is that each participant that engages with us will have a consistent nurse ally functioning really like a quarterback. So throughout the journey with ConsumerMedical, that nurse will be by their side, always the same nurse, a consistent team, because we know that if you have to keep telling your story again and again and again, at some point you just stop. It's too hard. So we really believe in that trusted relationship throughout the journey. Now, bolstering up that nurse ally, we have a dedicated clinical team around the nurse, and that team's made up of physicians. So we have a group of board-certified physicians in a variety of subspecialties that are there to help ensure that the information that we're sharing is up to date and accurate, but the physicians will also engage with the participants and the nurse allies to really go deep in the history of what's going on, answer questions, help with the navigation, and then our physicians will actually create customized questions for the participant to take back to their care team to really spark that meaningful dialogue that will help the patient make the best decisions possible. Also on our team are researchers, so we have medical librarians and health literacy experts to cull through the data, constantly looking at feeds from the FDA, peer-reviewed medical journals, all sorts of multimedia information to help curate the information that we share with our participants. Our expert medical opinion team is there to help with the physician selection piece, to steer people to the appropriate specialists, but also help facilitate remote expert opinions if that's something that's indicated in the particular situation. And then we developed a claims advocacy ally program because we really want to try and remove as many distractions as we can from that are on the patient's plate, right? Getting a new diagnosis is completely overwhelming and life-changing. You walk into the office, a physician's office, and you walk out with a diagnosis, everything is turned upside down. And so we really felt that if we could help with easing some of that burden of EOBs and surprise bills and all of the noise that gets in the way of truly engaging in your healthcare situation, we do our best to alleviate that so the patient can really focus with their care team on making a good decision. Now, I know I talk fast and I just threw a lot of information at you. So one of the ways that I like to bring our services to light, so to really make it alive, is to share a clinical example with you. Now, this isn't a COVID example, but it's one that it's a person that we engaged in with recently, and I thought it would be a nice example to share. So meet Nancy. She's a 52-year-old female who came to us with a new diagnosis of breast cancer. And her primary care physician referred her to a local oncologist who, based on her situation, her tumor markers, the cell biology, all of the things that go into decision-making for a breast cancer diagnosis, and was told that she needed a modified radical mastectomy, radiation therapy, and then adjuvant chemotherapy. And when Nancy came to us, she was overwhelmed with her choices. She had 3 different big pieces of treatment to consider, and she wasn't understanding what this all meant, why everything was happening, and importantly, she had 2 small children, school-age children at home, and she needed to know how to talk to them, like what's going to happen when she comes home and is suddenly bandaged up or not having the energy that's required to engage with her family. So she needed help to know how to talk to her children to set their expectations. So Nancy got connected with a nurse ally and a physician ally. They had several conference calls together to really dig deep into what was going on. It turned out that for Nancy, while she was having her surgery, we were able to facilitate a remote second opinion, so sending her records off and all of her information off to another expert just to get another opinion while she was recovering for her surgery. And to make a fairly complicated story short, it turns out that Nancy ultimately decided not to go ahead with the chemotherapy, but to do the radiation therapy alone. And the reason for this for Nancy was that she had a chronic kidney condition that put her at a very high risk for requiring dialysis in the future because of chronic renal failure from the chemotherapy side effects. On the flip side, she had an excellent prognosis with her surgery and radiation therapy. So for her, she decided that that incremental potential benefit from the chemotherapy wasn't worth the risk of facing dialysis for the rest of her life. So she opted to forego the chemotherapy at this point in time. So I like her example because it really shows that everyone brings something unique to the table, and for Nancy, through information acting as power and being able to have meaningful conversations with her own physicians, was really able to make the decision that was right for her. So I hope that gives you a sense of our passion in helping people navigate the healthcare system. I wanted to end with a slide that will be on your portal. I know many of you out there are either helping others navigate the healthcare system or are trying to do it on your own, which is a daunting task at best. And so I thought I'd be try and be helpful by sharing some pearls on how do I know if the healthcare information that's in front of me is credible. So when you're looking at healthcare information either online or in a bookstore or library, here's some things to think about and to help you process what's in front of you. So first, who is the author and what are their credentials? Is the person who created the information an expert in their field? What is the purpose of the information? So is the author trying to sell me something, or is it truly for an educational purpose? How recent is the information? So at ConsumerMedical, we like to use about 3 years as a cutoff for something that's considered quote unquote up to date. Now, there are absolutely exceptions to that. There's a big lag time in the printed word. So books can often be very meaningful and appropriate that are more than 3 years old. And while medicine is constantly changing, there are guidelines that stay in place for many years. So we use a 3-year time frame, but please use your judgment on whether or not to discredit something if it's a little older than that. And then lastly, does the information show any clear bias? Just look at the information and say, is this objective or is there some hidden meaning here? It's sort of similar to that second bullet there. So some examples of credible websites. There are a lot of government resources, medlineplus.gov, Teri's resources that she mentioned, nonprofit organizations like the American Health Association, the Cancer Society, things like that. And then medical providers. So many academic, big medical institutions like Mayo Clinic put information out there for the sole purpose of educating patients and their caregivers. There are some website guidelines out there for healthcare information. So there is an e-health code of ethics. You might have heard of the HON code that was established about 20 years ago. And their aim is really to ensure that websites provide quality, objective, and transparent medical information that meet the needs or are tailored to the needs of the audience, meaning patients or caregivers. So you might see at the bottom of some websites a little emblem that says HON certified, and that really just shows that the website creators shared their content with the HON code folks to make sure that their information was credible and meaningful. So with that, I will end my talk. I hope that you found this helpful. And Dave's smiling. I really, again, want to thank you for sharing your session with me today. Happy anniversary to the Advocacy group. It's really a wonderful organization, and I hope you all stay safe.
Thank you very much, Cindi. Incredible presentation and important information. Both Cindi and Teri, not only are these really important resources specific to mental health and patient navigation, but I hope for everybody in the audience, they're innovative models for how we can solve problems. And I really admire how you're putting the patient at the center of what you're trying to do in both instances. And also what I heard really clearly from both of you was the focus on compassion and what the individual is going through. So we're just incredibly grateful for your wisdom and your compassion in this. So thank you very much.
Thank you very much.
Yeah, I'm going to share just one slide and then hand it over to Jess to move us into working groups. With so many awareness months this month happening, we wanted to just give a quick overview, and this will live on the COVID Advocacy Exchange. So if you want to know what issues and what groups are celebrating May as observant months, you can see many of them here with a link to their organization. So just wanted to provide this for everybody as another resource if you're interested in other groups doing really great work for this month. So I'm going to hand it back to Jess. We're going to move into the breakout rooms, and then we'll end this session right in the breakout room. So before we separate into our 4 areas, just want to say what an honor it is to be together, and really excited for these working group conversations. Thank you.